Okay, let's get right into this. This video is going to talk about what President Biden originally promised in his pre-White House website, the articles that he produced, of what he wanted to do with Social Security benefits, and also specifically what he wanted to do with mental health. The big arch with this situation was getting basically mental health providers, especially with insurance companies, to go and treat in an equivalent way mental health with physical health. Now, the big thing, the where he wanted to end up, he's not going to end up there. He doesn't have enough time, and it didn't work out that way. But President Biden wanted to end up specifically where at the end of this road, he would be able to have an entire government group training people who help take care of their parents and paying those people a check. That was the ultimate goal of the pre-White House Biden website before he was president of the United States of America. Now, did he hit that mark? No. Is he coming up short of that mark? Yes. Is he getting close to that? Sorta. Here's what happened. Article, basically, September 9th, 2024. Bottom line is Biden administration released his historic final rule on behavioral health, physical health parity. Now, what you need to know about this was by bhbusiness.com. What you need to know about this is that the health insurance companies unfairly treat mental health. Now, mental health is rampant throughout the United States. It's rampant for basically a couple of reasons. Number one, we now know how to diagnose more of these mental health issues than we ever have before. Number two, there's a bit of overabuse of diagnostic impressions of mental health in academia. Number three, there are advantages in academia to having mental health where you can get special ABA accommodations, which allows people to have an advantage over other students. So they're doing it to get the advantage, to do better on tests, to get into better schools, to achieve basically a higher standing in society. And another one, money is a problem for everybody. Everybody's poor now, right? Everybody's poor. The Asian population, Latino population, Black population, the white population, the Indian population, everybody's poor. Everybody's poor now. The savings figures they're the worst ever. They're the worst. I mean, you could say ever, you could go back to when they didn't have savings because there were no banks, but they're the worst they've ever been. They're the worst they've ever been, okay? And then you have basically, of course, the ability to buy things. People talk about food. Try going into a Home Depot. Try going into a business store. It's even worse. It's even worse. All right. The Biden administration has released its final rule updating mental health parity compliance for group and individual health plans. Released Monday today, the final rule updates how federal agencies oversee whether health plans treat behavioral health benefits differently than physical health benefits. In short, it requires and spells out how health plans are to analyze non-quantitative treatment limitations. That's important. Remember that. Non-quantitative treatment limitations, NQTL. Remember that. NQTL. For both types of benefit and requires plans to remedy and disparity. The rule updates previous rules that enforce the Paul Wellstone and Pete Domenici Medical Health Parity and Addiction Equity Act of 2008. That's the MHPAEA. The administration released the proposed version of the rule in July 2023. Okay, so this was thought about in 2023. They're pushing it through now, 2024. Okay. Today, quote, my administration is taking action to address our nation's mental health crisis by ensuring mental health coverage will be covered at the same level as other health care for Americans. President Joe Biden said in a statement, there is no reason that breaking your arm should be treated differently than having a mental health condition. And he's right. President Biden is absolutely right on this one. There's a bias. People talk about it. They're in the know of insurance. People who aren't in the know, they're all just pissed off because they got to go and find a doctor that's outside of their insurance network, and it's not good. It's not good. So this is Biden's biggest win for like disabled people during his tenure as president of the United States. I see this as his biggest win. All of his other stuff just didn't develop. It didn't get out of committee. It didn't make it into the second round. It just didn't develop. But this is his biggest win. This is his greatest gift to the American people in his presidential, and remember, presidents don't always hit the ball as to what they were looking to promise, pre-White House. They promise a lot of stuff to get through, but they can't always hit the ball. Diana, thank you. for the $2 donation. That's absolutely amazing. Very, very cool. Which video, Princess 05, which video, whatchamacallit, where you think I was going to be on? Now, the rules apply to group health plans with new plan years starting after January 1st, 2025, with other more technical aspects of the rule going into effect a year later, so 2026. The new final rule applies to individual health plans starting on January 1st, 2026. NQTLs are non-numerical limits on benefits and include things such as prior authorization and other medical management techniques. Behavioral health. Executives and advocates have long argued that they and their patients are mistreated by health plans. It's true. A lot of people, when it comes to mental health, it's not good out there. People are not being treated properly because they can't get to see the provider they want to, or when they get the provider they want to, the provider ends up out of the jurisdiction of their plan because they're pissed off as to how the insurance company treated them. That's what keeps happening. They often point to practices that make it harder to get and stay in treatment. On top of that, providers often maintain that they are underpaid by health plans when providing services that are equivalent to physical health services. 100% true. 100% true. While the final rule released on Monday does not address the financial aspect of advocates' concerns, some maintain that it will have a financial impact on patients. When the proposed rule was released, behavioral health advocates lauded stronger enforcement provisions, while insurance industry advocates said the new rule was vague and onerous. Quote, the cost of the status quo is simply too high for the country to continue to pay, Rebecca Bagley, the president and CEO of nonprofit advocacy group, the Kennedy Forum, said in a statement. The economic impacts of inequitable mental health and substance use care have national and global economic implications for the United States. And we call on insurers and employers to work with the Kennedy Forum and the administration to find a way forward to make a reality. All right, so the Kennedy Forum points to research by RTI International that finds patients go to out-of-network providers 3.5 times as often for all behavioral health services on average compared to physical health. So what they're saying is you got to get out of, network, out of the jurisdiction of what basically the insurance is willing to pay. And the game is this. The insurance companies, they'll go cover whatever doctors are willing to receive the cheapest check to actually see you. And that's the problem with this. Like, if you want doctors that are just going to windmill you through, cool, I understand, got it, boom, 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 done, you're down, you're out. Then that's and the doctor, invoices it to the insurance sends them, cuts them a check and small amount of money. Doctor's not happy, client's not happy, insurance is happy. That's the problem with this system. Insurance being happy usually means you get a bad deal in it. Okay. It also finds that all physical health office visits garner 22% more reimbursement than behavioral health visits. Okay. Disparities are much more glaring for specialist care and behavioral health. Patients are 9 times more likely to go out of the network for visits with a psychiatrist than they are for a physician visit. Average reimbursement for a physician assistant visit is 19% higher than for a psychiatrist visit. Remember, we're talking about 3 main groups here. We're talking about psychiatrists, psychologists, and behavioralists. Those are your 3 main groups for this stuff, okay? Vice President and Democratic nominee for President Kamala Harris said in a statement that the move was a historic rule that will expand mental health care across our nation so more of our loved ones, neighbors, coworkers, and classmates receive the care they deserve. Now, remember, this rule is, the beginning of it is like, it's an assessment rule, right? It's form some committees, do some studies, figure out the numbers, what are the metrics, do some actuarial stuff to figure out how we need to make this match the physical. So it's really a figure it out with the numbers rule, and then we'll take a look at it and put it in place and make it roll. All right. What's in the final rule? Group and individual health plans are forbidden from imposing NQTLs on behavioral health benefits that are more restrictive than physical health benefits. The rule uses the language of mental health and substance use disorder benefits and medical/surgical benefits. Now, what's interesting about this is that a lot of the homeless and the low income that I represent that have some sort of, use and abuse issue. Because remember, a lot of this stuff comes into what's called a dual diagnosis situation. What is a dual diagnosis situation? Dual diagnosis is where they have a main impairment that limits them, and then another impairment, which is their substance abuse, which could be anything. It could be cigarettes, it could be alcohol, it could be, crack, it could be anything, right? So the bottom line is, you got all of these. This is actually going to help fight a lot of the substance abuse issues because the government is going to make the insurance companies give more money to basically get people actual treatment for their substance abuse issues. Now, some of you will say, well, I don't pay for that. And my response to that is, okay, I get it. But at the same time, when you get robbed by a drug user, you know what I mean? It's you know what I mean? It is what it is. And I get it. The drug should have never even made it into this country. I get it. I understand it. You know, and you know what the funny thing about that is too? You know, when you have open borders, you do tend to see, just to be fair, you do tend to see a lot of illegal things coming in this country. I'm not saying somebody had welded the gates open. I'm not saying that they were actually effing welded open. Like you have to understand, you had to get an actual diesel powered welder down a road completely away from electricity and then weld the gates physically open. You know what I mean? Like, I know how to weld. But when you're stick welding on a gate in the middle of nowhere to do that, you know, you gotta say, like, damn, you know what I mean? Which is why I stand by, and I feel very strongly about this. The best Republican president of the past 4 years has to be Biden. Here's why. Hear me out. The first 3 years, he did the most extreme left stuff you could imagine. I mean, it was throw the ball as far as you can left, right? Then in that last year, massive exporter of oil, cut down those trees, hop, 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 drill that oil, baby, drill it. All these things, right? It's ironic because he needed his numbers to improve. So he went full economy mode. I mean, he became the thing that he said he would never be in his final year. It's amazing. It's just amazing. So, I think it's interesting. All right, here we go. Next thing. What's in the final rule? So plans are required to collect data to assess the impact of NQTLs on behavioral health access and access to physical health care, compare the data between each type of care, and act to remedy the disparities. So remember, this whole thing is about, like, step one, figure out the math, get the numbers down. How biased is our insurance payment system for medical treatment towards the physical side, as opposed to it not being good for the mental side, right? That's step one. It also requires that group and individual health plans conduct comparative analyses as dictated by the Consolidated Appropriations Act of 2021. These comparative analyses must be made available to the Department of the Treasury, the Department of Labor, and the Department of Health and Human Services, as well as state regulators and plan members. The rule also describes the content of these analyses. They must include. So here's the stuff that's got to include: a description of the NQTL and the affected benefit. So, like, the description of the thing you're going to get with the mental health, right? The evidentiary standards used to decide the NQTL. Okay. So we got some elements, we're getting some law in there. How these standards are applied, right? Creating a box of how we're going to do this consistently among all insurance companies and all doctors. A demonstration of the comparability between NQTLs for behavioral health and physical health benefits. So that's where the math comes in. Why are we paying less to these mental health doctors than we are to these physical doctors? How much more do we need to pay these mental doctors than these physical doctors? Or if you want to apply it the federal government way, how do we give the physical doctors less to make it equivalent with the mental health doctors? They play that game. You'll see a little of that shit coming in. They do that all the time. All right, plans that are deemed to be out of compliance will be required by the 3 federal agencies to stop using that non-compliant NQTL. The punishment. Somebody's not getting money, right? Other elements of ensuring that NQTLs don't limit access to behavioral health care include ensuring essential mental health and addiction treatment services are covered. Analysis of NQTLs are also required to assess things like network compositions and out-of-network. The final rule also specifically ends the ability of self-funded non-federal government plans to opt out of MHPAEA compliance. Okay. Quote, as someone who has watched insurers' blatant disregard for federal parity regulations for years, I'm thrilled to see this rule finalized. It is a critical step to holding insurance companies accountable and ending discriminatory denials of care Chief Policy Officer David Lloyd for the mental health advocacy organization Inseparable said in a statement. All right, so in summary, what has Biden done? Biden, a lot of his rules, he's not the guy who achieved the touchdown with a lot of the things that he did that was right. He's the guy. Yeah, no, Princess 05. I know it's you, Diana. Thank you for the $2 donation. But I do know it's you. I saw your face in the picture. I got that. I got that. So here's the thing. Biden was not the touchdown guy. Biden was the guy who was like the quarterback who was having a meeting with his team about how they were going to begin doing something that's helpful for the American people. He was the guy who was like, how are we going to get the committees together, the experts together? How are we going to make statistics to help the future of this federal government create plans that work better for the American people? He was the huddle master at creating committees and getting those committees to start figuring out the numbers. Was he the guy that would throw the football and hope for a solution? No, he never made it. He never made it to the throw. But the huddle, he got the huddle down. He got that very well. All right. We're going to be heading right over to the next video, which are basically 5 big changes that you're going to be seeing when it comes to Social Security benefits and the Social Security Administration going into 2025. Please remember to like. Please remember to subscribe. Also, head over to Google. If you haven't left a star review on Google for the law firm, please consider it. They help me wake up and continue forward. Please remember, I wake up at 7:30-ish most days. I got a hearing tomorrow at 8:30. I'm going to be working until basically the middle of the night, like we will tonight. We'll be live all the way until probably 1:30-ish, maybe a little bit later. Bottom line is this. The hours are killers. The pay is horrible. Hit me up with some stars. Go to Google, type in disability resolution, Florida disability resolution law firm, throw some stars up there. All right. With that said, I will go ahead and go to the next video now. And please remember, I go live on Mondays. Which is today. Forgot about that. No, I didn't. I made a thumbnail. We're good. I already preloaded the thumbnail. Did I do 3 or 4? Well, whatever. We're going to do 3 or 4 videos. However many I uploaded, that's how many we're doing. So we're going to do either 3 or 4 videos. The last video will be the live. You guys know how that works. You call in, I answer questions. It's insanity. No attorney I know goes live on YouTube and just wings it by taking literal live calls. With that said, also, if you want a private session, mini contract is below. If you need an hour to go through something with me, that's fine. I will catch you all a little bit later. Please have a wonderful night, and I will see you at the next video. And I'll put the little link in the chat section below. I'll catch you soon, and we'll go from there. Thank you so much. Attorney Walter Hnot. All right. Bye-bye, everybody. Bye-bye.